we are from China. So in China, we have physiotherapists, we have medical imaging. So that's quite familiar with us back in China. But for some occupations here in Australia, we're not so familiar with. Like we don't have so many occupational therapists. We don't have so many speech pathologists. So can you explain what is the difference between like OT and PT? What does speech pathologists study and do after their graduation? That's totally new to many international students.
When I was at Shanghai University of Sport, they were teaching rehabilitation therapy. And so speech pathology, occupational therapy, physiotherapy was all linked together. Here it's separate divisions. Speech pathology is about the head and neck. So somebody might have difficulty speaking or difficulty swallowing. Somebody might have difficulty understanding and thinking about the words they're going to use when they speak. So this person might have had an injury to their head, or they might have had a stroke affecting the head, or it might be a child who's had difficulty with their hearing, so that then they didn't learn to speak well. So this is about making sounds, but also understanding and about communication skills. So particularly there's a lot of work being done with children, as children often have difficulty with their speech or swallowing or other impairment, and a lot of work done with older people who've had a stroke or an injury, and that has given them a speech or an understanding impairment. Occupational therapy is a sister to physiotherapy.
Very close sister.
Very close sister.
How to distinguish the difference?
Quite an overlap. So in physiotherapy, we tend to look at what's the problem, I can't run, and then break it down to why can't you run? Oh, it's my knee, it's my back, it's my shoulder. And then look at, is it moving? Is it strong? And we break it down into those little pieces, and then we treat that little piece, so the weakness or the stiffness, and then put it back into the running. An occupational therapy comes from the other point of view, and they say, you can't run. What can we do to make the world a better place for you to run? We can have level ground, we can have railings, we can have better shoes, and we can make the world adapt to your need to run. So if I am having difficulty driving my car, maybe you see a physiotherapist because your knee's not stiff, your knee's not bending, or your knee's too weak. But you go to an occupational therapist and they say, let's change your car. Let's move the pedals. Let's give you bigger pedals, easier pedals. And so they look at the problems you're having, integrating into your work or integrating into your leisure, and they look at solving those problems. So it might be mobility, access, technological devices to help you to integrate so that you've got devices that you can use in your hands that fit your hands. Your hands might be weak, or you might have arthritis. So you have devices that fit your hands. You have a car that is designed so that you can drive it and it fits your needs. So it's looking at difficulties in participating in the world from a participation point rather than from an impairment point.
So put it simply, PT is like treat the patient.
Or even just a part of the patient.
But OT is like to change the world, the environment, the facilities, the equipment to help the person to function.
Yes, and to find what capabilities the person has and look at using those capabilities to give them opportunities to work, for recreation, for leisure. So working from a strengths-based perspective to get people back into leisure, to get people back at work. Whereas a physiotherapist is looking at the piece of the person, movement, strength, muscles, bones, or motor retraining if you've had a stroke or a head injury or lung condition.
所以呢，我简单总结一下，给我们的观众总结一下，就是呢，我可能也到今天才彻底明白这个 OT、PT 最核心的区别是什么。这个 Jennie 教授呢，帮我们简单的讲明白了。这个物理治疗 PT 呢，更加关注的是病人本身，你的肌肉、骨骼、神经的治疗，而 OT 呢，除了关注病人本身之外，是通过改变我们的设备、我们的环境、我们的设施、我们的汽车、我们的椅子、我们的轮椅、我们的房间，来使这个病人能够正常的工作跟学习。所以呢 ，so that's the point. I understand why, for the master program, OT master program, they can admit students from non-health related programs into this program to start a master postgraduate program. So because it's not that health and there's technology or
anatomy,
related,
physiology.
Yeah, not that specific. So they need a broader, wider range
Yes.
of knowledge to help the patient to recover.
Yes,
Yeah.
yes, and really good problem-solving skills to look at challenges and to break them down and to resolve them, to
Yeah.
give the patients the opportunity to participate.